Hey everyone, it's Tony again with TRW Medical. If you're interested in learning how to insert A-lines, I am going to be doing some arterial line insertions, radial. And if you're in the NICU, you're an RT, or whoever, I can also teach the radial and the post-tib, and also the UACs, though I never do those, just the UVCs in an emergency. But we'll be talking about UVC placement, that kind of thing, because that's part of NRP anyway, the neonatal resuscitation program. So we'll talk about the invasive monitoring. We're going to talk about the sterile preparation of the A-line. We're going to talk about the type of catheter, over the guide wire catheter insertion, how to secure it, how to securely tape. And I was taught how to secure with needle and thread, and also tape. I do both. So if you pull one of my A-lines out, you probably pull the shoulder off too. I'm just kidding, but it's very secure. I can teach you how to do that. We'll talk about the different type of lines, the hard, rigid, non-compressible type of pressure tubing that you have to use for A-lines. Show you the sterile technique in prepping, and how do you position the radial A-line or the brachial. And yes, I do femorals too, but it depends where you work. It depends where you work, but the most conventional, the best place to start is going to be the radial site. And we're going to discuss the how to do an Allen's test, check for collateral circulation and that kind of thing. So we're going to understand also the waveform, the components of the waveform of an arterial line. We'll discuss the dicrotic notch and many other things. Complications and troubleshooting the A-line. I have to do that all the time at work. So sometimes it can be a very simple thing. But we'll talk about the maps and how to calculate some different formulas, which are very interesting, which I'm not going to get into now. But when you understand the waveform, we're going to study that, what the waveform means. For example, peak systolic pressure, what does that look like on the waveform? Dicrotic notch, diastolic pressure, and that kind of thing. And the anacrotic notch.